is close to collapse, according to warnings from insiders and whistleblowers who've spoken to a BBC Newsnight investigation. It found that ambulance crews are often waiting many hours, sometimes whole 12-hour shifts outside hospitals, unable to respond to further emergency calls. One paramedic told the BBC about the backlog outside A&E.
I think the hospitals tolerate it because, if I'm honest, whilst we're there, we're not taking them more patients. And they see it as an ambulance problem rather than a hospital problem. But something needs to be done to free up the ambulance service, to allow them to get back on the road where they operate and deal with the patients in the community that haven't had any assessment. I've had nurses say to me, senior sisters say to me, if we let you go, you'll just bring us more. Why do you bring us patients? Well, we bring you patients because we're an ambulance service and you're a hospital.
Well, Liz Harris is head of professional standards at the College of Paramedics, the industry body for the ambulance service, and Dr. Adrian Boyle, vice chair and soon to be president of the Royal College of Emergency Medicine. Welcome to you both. Liz Harris, to you first. Does that account we just heard there ring true to you?
Absolutely. Absolutely. We've been hearing this from our frontline paramedics for quite a while now. I think that the stark images of the ambulances lining up outside of the emergency departments is certainly an unmistakable and bleak warning signal that the whole system is in significant trouble and not able to deliver the healthcare that we would expect in this country.
Even to the extent that we heard their senior sisters saying to ambulance operators and paramedics, look, we can't let you go because we can't take any more, so we're going to keep you here. They're actually dragging their feet a little bit and admitting patients in order that they don't have more admissions.
Yeah, I'm not sure I would agree with that point specifically. I don't think anybody in healthcare is dragging their feet at all. Emergency departments and hospitals are absolutely full of patients. In fact, they just don't have the space and the capacity. And so it's really important to not apportion any blame to any area of the healthcare at this point. So not the ambulance service's fault, it's not the emergency department's fault, it's not even the GP's fault or the patient's fault, it's a system-wide issue.
Yeah, I'm just looking at the data for June, which we got on ambulance response times yesterday. It took an average of 51 minutes and 38 seconds to respond to an emergency call, such as heart attacks and strokes. In May, they were 39 minutes and 58 seconds. So that's a huge leap of 12 minutes in just 1 month.
Absolutely, and it'll continue to rise if we don't see some tangible solutions in the short term and the long term. We're currently seeing the normal mix of patients, including anecdotally more patients with mental health difficulties. COVID has obviously lengthened pre-planned waiting times, so people that had their treatments or procedures delayed, which of course means that there's more complications and people are now ringing 999 or arriving at their emergency department. And of course these current high temperatures as well, they're contributing towards increased demand on ambulance services in the hospitals.
OK. Dr. Adrian Boyle, this is not an ambulance problem, it's a bed problem, it's a staff problem, it's a space problem. Is that right?
Yeah, completely. I mean, this is happening because our hospitals are full, and what that in turn is doing is leading to full emergency departments. If you look at the figures for the ambulance data, absolutely they're terrible in June, but also the long stays in emergency departments in June have been the worst. They've been worse than any winter that we've ever had. And fundamentally, the problem is that we're short of about 14,000 beds across the NHS. Now, that sounds like an awful lot of beds, but if you break it down to what that means per hospital, that's between 1 and 3 wards extra per hospital. So it's all connected, and you can't view this in isolation. Again, I agree with our previous speaker. When the emergency departments aren't dragging their feet and holding hands, we really get that releasing ambulances is an important thing to do. It's just if we haven't got space, we can't do it.
Yeah, I mean, the Department of Health said they've given an extra £150 million to try and support the service. From what you're saying, that's not enough to increase to make a dent in the problem.
So just putting it, I mean, we need to look at this as a whole system-wide thing. And actually, the way to try and fix this is to actually try and unpick it and actually go for where the real problems are. And the real problems are, there's a lot of people in hospital who can't get out because the interface between acute hospitals and social care isn't working as it should. Now, everybody comes and talks about social care, and we'll keep doing it because no one seems to be fixing the problem.
OK, well, I mean, to be fair, the Chancellor did, and the last government, well, the current government, but the former Chancellor now, put 1.25% on both employees and employers' national insurance, but that'll take some time to come through. What you're saying now is that this is in summer. Does that bode very ill for winter?
Yes. I mean, we're really worried about this. Now, we're seeing that COVID is absolutely not a seasonal disease, but we know that we will see more people who will need admitting to hospital over winter, because that always happens. It's a combination of flu and other respiratory illnesses. They're just more common in winter, and this leads to more people needing it. So, yes, we're extremely worried about this. We need to have a really effective, thought-through, system-wide plan for this winter.
Liz Harris, do you think there's any logistical fix you could do in the short term? Because it seems it's this interface between the ambulances arriving, not being able to, put patients into A&E. Is there some kind of technical fix that can happen in the short term?
Well, we've issued a statement previously with colleagues of Adrian's at the Royal College of Emergency Medicine, trying to put in some short-term solutions, like real tangible solutions that managers on the ground and the people with the boots on the ground can try and facilitate, at 3 a.m. in the morning when there is 25 ambulances stuck outside an emergency department. Just to put that into context, that'll be every ambulance in that area. So there won't be any more ambulances out there to respond to 999s. And that's really, really upsetting and heartbreaking for us all. Paramedics and ambulance colleagues don't turn up to work every shift to stand in a queue. They turn up to improve life and to save a life. And so that's absolutely demoralising and an absolute appalling waste of the NHS's most valuable asset, which is, of course, its staff. And because the ambulances are stuck outside A&E, they can't then respond. And the words that are being used now, thankfully, are the patient that harm. Patients are dying in the community because 999 responses are not available, and that's an absolute tragedy.
Yeah, and Dr. Adrian Boyle, are you in any doubt this is leading to a significant number of unnecessary deaths?
No, so we absolutely agree with our colleagues from the College of Paramedics. We recognise that this is a serious public health problem, and the fundamental contract between that the public expects, where if you have an acute emergency, you call for an ambulance, it arrives promptly, can take you to a hospital where you're handed over quickly to skilled emergency department staff who can do a few tests, provide initial treatment, and then decide whether you need to be admitted to hospital promptly. And in total, that process should take no more than about 6 hours, start to finish. That's taking an awful lot longer now, and that fundamental contract is broken.
Yeah. And Liz Harris, just looking at the categories of emergency calls, Category 1, life-threatening injuries and illnesses, heart attacks, and then you've got Category 2, strokes, and then Category 3, abdominal pains, etc. Do we need to refine these categories? Are people doing this themselves, or many more people taking themselves to hospital?
I think people are ending up having to take themselves to hospital because of the long waits. But of course, some people can't. The Category 1s are, yes, and 2s are the most kind of what you would class as life-threatening potentially. But they're a very small minority of the calls, particularly the Category 1s. So we've got a huge amount of patients that don't meet those high-priority calls that are less seriously ill and perhaps won't die within the next 12 hours. But they've got conditions such as elderly patients that have fallen and are waiting on the floor for over 12 hours for an ambulance. So the significant impact upon their ability to recover and survive from that incident is really impacted by that delay. But we don't see that immediately in terms of harm.
Yeah, I mean, Dr. Boyle, is there anything that the general public can do to alleviate? Would you give any advice, or would you ask anyone to refrain from calling an ambulance in some situations?
No, I think the public need to know that they need to be assured that if they believe they're seriously unwell or injured, that they should call an ambulance. If they find that there's going to be a long delay and they can think about making some way alternative to hospital that is safe, then they should consider that. But I think changing the categories and just changing the measurement methods, I mean, we see this all the time in the public sector, just changing the way you measure something is not the way to try and fix a problem. You actually need to get in and actually try and fix the problem, not the measurement method.
But people, it sounds to me like you're saying that the system will take a big overhaul. You need 14,000 new beds. That will take months, maybe years. So we just need to reconcile ourselves with the kind of ambulance service we now have.
Well, no, I think we can actually improve things quite quickly. It would not, yes, you're right, it would take an awful long time to train a bunch bunch of doctors and nurses, but actually training people to work in social care and making sure that they're sufficiently incentivised to go and work in social care, and that might mean terms and conditions and salary, that would do an awful lot quite quickly to empty our hospitals. We have lots of social care beds which aren't being used because there aren't enough staff to work them.
OK, so it's a staff, beds and space problem. Liz Harris, Dr Adrian Boyle, thank you both.
It is 8:20. Now, what makes